ChatGerry, root cause and trigger of my stroke, a patient's reflection with clinical confirmation. Number 1370, VMT Sharp 711, September 27, 2025. Gerald C. EclaireMD Foundation. Category: Neuroscience and Stroke. Mission statement: I write these papers not for fame or recognition. I have already lived a long and successful life, though not always a healthy one. My purpose now is to share what I have learned so that others may better understand their own conditions, prevent illness, and live longer, healthier lives. My health background: I came to Silicon Valley in 1976 and lived a high-pressure life for decades. Between 1977 and 2010, my health declined step by step: overweight, then obesity, then type 2 diabetes, high blood pressure, high cholesterol, and 5 cardiovascular episodes. I also developed nerve damage, including a foot ulcer, retinopathy, and kidney disease. By 2010, I finally woke up to the danger. I left the high-tech sector that had driven much of my stress, stopped relying on multiple medications, and adopted a strict lifestyle management, diet control, daily walking, good sleep, and emotional stress management. From that point on, I placed my healthcare fully under the Stanford healthcare system, which has tracked all my records since 2010. Still, the earlier damage had already left deep marks. By 1985, I weighed 200 pounds, BMI 28.7. By 1990, my glucose was over 200 milligrams per deciliter. These years of neglect became the seeds of my future health complications. The stroke event and discovery. On June 21, 2025, I suffered a hemorrhagic stroke. In the following 3 months, I studied intensely to peel back the layers and discover what really happened. After reading Drive, Neil Schwartz's letter from the Stanford Stroke Center, I found that his clinical diagnosis matched my own self-diagnosis. The root cause was long-term damage to my cerebral microvessels from years of obesity and poorly controlled diabetes. The trigger was an acute blood pressure surge to 175 millimeters of mercury. On the day of the stroke, the CT images of bright white spots on my brain microvessels confirmed what I suspected. Decades of vessel damage made me vulnerable. How I quantify the damage? I use the viscoplastic medicine theory, VMT, which applies principles from physics and engineering to medicine. In this framework, the first 20 years of neglect, from 1977 to 2010, created about 91% of the cumulative vessel damage. The following 16 years of strict lifestyle, from 2010 to 2025, added only 9%. The stroke was like an impact rupture, not caused by a single bad day, but by decades of strain slowly lowering the vessel's breaking point, until one surge pushed it past the limit. This is why I now measure my body with scientific precision. 96 daily glucose readings from a continuous glucose monitor, 24 blood pressure checks daily, producing 96 manual entries including systolic, diastolic, pulse pressure, and heart rate. I cannot erase my vessel damage from decades past, but I can do everything possible to prevent another rupture. Clinical confirmation from Dr. Schwartz. Dr. Schwartz's letter made it clear: my stroke was most likely a hypertensive hemorrhage, not a vascular malformation. He found signs of hardened arteries, small vessel disease, and long-term vascular stress. He noted that I had seizures after the stroke, but those are now under control with medication. His conclusion fits mine: the 175 millimeters of mercury spike was the trigger of stroke. The root cause was years of unattended obesity, BMI 32 around from 1985 to 2010, and uncontrolled diabetes, hemoglobin A1C 12% during from 1990 to 2010. Why this matters? This case shows why early neglect leaves lasting footprints. Most of my vessel damage was done in the first 20 years. Lifestyle discipline later slowed progression but could not erase old scars. Doctors usually cannot put percentages on damage, but my VMT energy model allows me to express this reality in numbers: 91% versus 9%. This brings engineering precision to what medicine often describes only in general terms. Conclusion: root cause, long-term vessel damage from obesity, diabetes, and hidden hypertension. Trigger: the acute surge to 175 millimeters of mercury on June 21, 2025. Framework: VMT energy accumulation explains how decades of stress weakened my cerebral microvessels until rupture became inevitable. Dr. Schwartz's clinical report and my VMT analysis are not two competing views, they are two sides of the same truth. My message is simple: do not wait 20 years to take care of your health. By the time you wake up, much of the damage may already be irreversible. But with discipline, you can still slow decline and extend your life. Disclaimer: this content is provided for educational reference only, and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article, and its related materials belong to the author, Gerald C.